Hi, practicing dentistry in Canada after BDS is the topic we are going to discuss today. We are also going to discuss the two routes in which you can practice in Canada, and towards the end, we'll be comparing the advantages and disadvantages of both. If you are interested, stay tuned. Hi, I'm Dr. Satish Kumar and this is Kaizen Dental. Our aim here is to help dentists succeed. So, to practice in Canada, what do you need to get done? You need to have a NDEB certification. What is an NDEB certification? NDEB stands for National Dental Examination Board. Do not confuse this with NBDE of the United States. Now, for the certification process, if you are from one of the accredited universities, that includes universities from Ireland, Australia, New Zealand, from Canada itself, or from the United States, you can directly enter into the NDEB certification process. If you are from India, Bangladesh, Sri Lanka, then you might fall into the non-accredited dental program. Means your degree is directly not valid in Canada. So you will have to give the degree completion process or enter into the equivalency program. For those who are in the non-accredited dental program, the first step involves getting your credentials verified. This process would cost you 900 Canadian dollars. There are two sets of documents you need to upload in the NDEB website. The first set is by the applicants themselves. This includes your degree, your internship completion certificate. Third, a government approved identity proof. This is basically to prove you're a citizen of the particular country. And fourth, if you have changed your name, you need a notarized copy of the same. The most important thing you need to remember is, if this is in a local language, you need to visit a licensed English translator, get it converted into English, and then upload the documents. After that, you need to approach your university and ask them to submit two sets of documents. The first set is basically your degree completion along with academic record, and the second is transcripts of all your marks obtained during your BDS course. It is very important that when you are going through this process, you check each and every document carefully, because this process takes approximately 16 to 18 weeks, and if you do a goof up, you will lose about 4 months restarting the entire process. Once you are done with your credential verification, you have to prepare for the AFK exam, that is Assessment of Fundamental Knowledge. The Assessment of Fundamental Knowledge is a 6-hour exam carried out in the morning and afternoon with a half-an-hour break in between. It consists of 300 questions. You need to score at least 75% to pass it. This exam would cost you 800 Canadian dollars. You're given 3 attempts to clear the exam. The exam is conducted twice a year, and you would come to know about your results in approximately 10 weeks. In these 300 questions, there will be all sorts of questions from your basic sciences to your clinical knowledge. It's a basic multiple choice question examination. After the AFK exam, you need to decide whether you are getting into the equivalency part of the program or into the degree completion. In degree completion, after your AFK exam, you need to apply to the various universities of Canada. They have degree completion programs of 2 years. To enter them, after your AFK exam, there might be only an interview, or certain universities have a bench test as well. In the bench test, you are asked to do certain procedures on a dental mannequin. For this, scoring well in your AFK exam is extremely important. The course is of a 2-year duration and would cost you 50,000 to 100,000 Canadian dollars per year. After you clear the degree completion program, you enter into the NDEB certification process. But if you do not get into the degree completion program, or you're not interested in joining a university out there, then you continue with the equivalency process. If you're continuing with the equivalency process, you have to give 2 more examinations. The first is the ACJ and the second ACS. ACJ stands for Assessment of Clinical Judgment. ACS stands for Assessment of Clinical Skill. In the Assessment of Clinical Judgment, it's again a 6-hour exam with a half-an-hour break in between, held in the morning and in the afternoon. There are questions related to clinical diagnosis and treatment planning. In the first half, usually there are questions with detailed case history explained, along with maybe photographs. You will be asked to diagnose or treatment plan a particular case. In the second half, there are radiographic interpretation questions along with case history. The entire process of the ACJ exam is to understand when you face various clinical situations, how you would deal with them. This exam currently costs 1350, that's 1,350 Canadian dollars. You get your results within 6 weeks. You have 3 attempts to clear them and you need to score 75% marks. This exam can be taken in Canada or certain pro-metric centers approved by them like Australia and United Kingdom. Then there is the ACS or Assessment of Clinical Skill Examination. It is a 2-day examination of 6 hours duration each. In this, you are expected to do 12 dental procedures on dental mannequins. The various procedures include Class 2 preparation for amalgam restoration, Class 2 amalgam restoration, Class 2 composite restoration, tooth preparation to get a full metal crown or a metal ceramic crown, access cavity preparations, and so on. The ACS exam costs 9,000 Canadian dollars. You have 3 attempts to clear it and you get the results within 6 to 8 weeks duration. Now, there is one question whether the ACJ exam and the ACS exam can be taken together or have to be taken separately. Usually, the ACJ exam is conducted on a Friday and the ACS is on a Saturday and Sunday simultaneously. So you can take the ACJ and ACS exam together. There are people who have taken both the exams in one go and have cleared. But at times, preparing for both simultaneously becomes difficult. And you need to remember you have only 3 attempts each. So using your attempts wisely is very important. So it is preferred to give the ACJ exam in the first attempt. Then in the next cycle, that is after 6 months, take the ACS exam. Now once you're done with your equivalency process or with your degree completion process, then you have to get into the NDEB certification process. The NDEB certification process costs you initially 400 Canadian dollars to register. Then you need to give a written exam, which would cost you 1,000 Canadian dollars, followed by a OSCE, that's the OSCE examination, which would again cost you $1,000. The OSCE exam is basically a station-based exam. What does that mean? When you enter a hall, there will be various cubicles or stations with various cases explained. There might be photographs, there might be radiographs. Based on all the findings, you will have to come up with assessments and answer the questions given. There might also be questions in which you will have to write prescriptions based on the rules and regulations out there. Once you pass these examinations, you can apply to the NDEB for provisional license. After getting the provisional license, you need to decide which province. What is province, by the way? Province is like how you have states in India. How certain states in India have different laws. Similarly, provinces in Canada have different registration procedures. So once you decide which province you want to practice in, you need to go there, submit your provisional license, follow the registration process, and get a permanent license to practice out there. Before we move forward to discussing which is better, the degree completion process or the equivalency program, I would like to remind you that we put a lot of effort into these videos. If you like them, please do not forget to hit the like button below. And I'm sure you're already subscribed to our channel if you plan to take your dentistry career to the next level. If you're not, do not forget to subscribe to our channel. Now, the 4 points to consider when you're selecting between degree completion and the equivalency process. Point number 1, the degree. When you finish your equivalency process, you're still a BDS graduate licensed to practice in Canada. But if you complete your degree completion process, then you get a DDS degree or a DMD degree, depending upon the university. Your question would be, what is a DMD degree? It is similar to a DDS degree. Certain universities state the degree they give you has DMD. There's no major difference in it. Now, what is the advantage of getting a DDS or a DMD degree? Certain states in the United States let you practice based on the DDS or DMD degree obtained in Canada. There are certain countries where this degree is valid, where your BDS degree from India might not be valid. But if you're planning to settle down in Canada and practice, then BDS degree license to practice, which you get from the equivalency process, is more than sufficient. Second is job opportunities after you do your degree completion or your equivalency process. There are certain private practitioners in Canada who prefer graduates who have done their degree completion rather than their equivalency process. The reason being, they feel you've got used to treating Canadian patients in the Canadian scenario. That does not mean if you get out through the equivalency process, you will not find jobs. This is a preference of certain private practitioners only. The third is the cost. To do the degree completion certificate, you need to spend approximately 50,000 to 100,000 Canadian dollars per year for 2 years. Compared to that, the equivalency process is a lot cheaper, with both the exams coming to approximately 12,000 to 13,000 Canadian dollars per attempt. The fourth is the duration. If you're clearing the ACS and the ACJ exam in one attempt, then you will be out of the equivalency process in a year after you give your AFK examination. But the degree completion process takes 2 full years. On the other hand, if you have repeats in the ACJ or ACS exam, you might also end up spending more time in the equivalency process as compared to the degree completion. Now, there are some who would say, sir, I'm okay with both the process. Which one is better? Our suggestion to them is, first give your AFK exam wholeheartedly. Try scoring the maximum marks you can, because that is very important to get into the degree completion process. Once you clear your AFK exam, apply to the various universities. Simultaneously, prepare for your ACJ exam. If you get a call by one of those universities, you crack the interview and the bench test and get into them, well and good. If you do not, prepare for your ACJ and ACS exam, clear them one after the other. Take whichever opportunity comes first and get into the Canadian dental system. I hope all your queries have been answered in this video. If not, you can follow us on Instagram and ping us out there. I'm Dr. Satish Kumar and this is Kaizen Dental. Our aim here is to help dentists succeed.